Good morning. This is All India Radio, Kohima. The morning news read by Jonas Yantan. Nagaland Chief Minister Nipirio yesterday held a video conference with all the DCs, SPs and Chief Medical Officers, CMOs, of the 11 districts and reviewed the preparedness of the districts in the fight against COVID-19 pandemic. The CMOs briefed the Chief Minister on the improvements carried out in the hospitals and on the availability of the medical equipments and other accessories as on date. State spokesperson for COVID-19 and Minister Nipa Krono said that during the video conference, the Chief Minister asked all the district officers to keep a strict vigil on the situation and keep it under control. Rio announced that the state government will compensate an amount of 10 lakh rupees in addition to the centre's Pradhan Mantri Garib Kalyan package, which offers 50 lakh rupees insurance scheme against accidents for health workers fighting COVID-19 in government hospitals and healthcare centres. Centre has asked states and union territories to strictly implement lockdown measures in letter and spirit. In a letter to state chief secretaries and UT administrators, Home Secretary Ajay Bhalla said it has been noticed that some states and UTs are allowing exceptions beyond what has been permitted under the lockdown. He said this amounts to violation of the lockdown measures announced by the centre under the Disaster Management Act and may defeat the overall objective of containing the spread of COVID-19. Principal Director of Health and Family Welfare Department, Dr. Vizole Sokre, visited Mon, Longling and Twensang districts yesterday with a team of directorate officials to assess the preparedness for management and containment of COVID-19. During the visit, the Principal Director had meetings with the district medical officers in the presence of Deputy Commissioner and Superintendent of Police in the 3 districts. Dr. Vizole said the districts are fortunate to have dynamic DCs and SPs who are really concerned about the health workers in the districts and are actively involved in all the activities pertaining to COVID-19. He also added that health personnel encountered this kind of situations several times in the past and encouraged them to have courage even now. Dr. Vizole also appealed to the district team to strengthen awareness and sensitization and surveillance activity. The centre has blacklisted 960 foreigners who were found involved in Tablighi Jamaat activities at Nizamuddin area in the national capital on tourist visas. It has also cancelled their Indian visas. The Home Ministry has directed Delhi Police and Directors General of Police of other concerned states to take necessary legal action against the 960 foreigners for violating the provisions of the Foreigners Act 1946 and the Disaster Management Act 2005. The foreigners, along with others, were involved in Tablighi Jamaat despite the announcement of 21-day lockdown and social distancing measures in view of COVID-19, who reportedly led to spread the virus in some people in different parts of the country. Prime Minister Narendra Modi will share a video message with the people at 9 this morning. In a tweet, Modi said that he will share a small video message with his fellow Indians at 9 a.m. Centre has launched a mobile app developed in public-private partnership to bring the people of India together in a resolute fight against COVID-19. The app, called Arogya Setu, joins Digital India for the health and well-being of every Indian. The app will enable people to assess themselves the risk for their catching the coronavirus infection. It will calculate this based on their interaction with others using cutting-edge Bluetooth technology, algorithms, and artificial intelligence. Once installed in a smartphone through an easy and user-friendly process, the app detects other devices with Arogya Setu installed that come in the proximity of that phone. The app can then calculate the risk of infection based on sophisticated parameters if any of these contacts is tested positive. The app will help the government take necessary timely steps for assessing risk of spread of COVID-19 infection and ensuring isolation where required. With that, we end the morning news. Have a nice day.